Hello, my name is Victoria, and this is my podcast. This podcast is about how to react in order to have an emergency. As we know, the emergencies are all the time, and you don't know how and when they will be. Normally, the emergencies happen in 1 second, and you have to know how to react. The attention pre-hospital is an important thing. It's the first of all thing that you have to do because we have just some seconds in order to save a life or lost a life. First of all, you have to know that you will be in work with a lot of tension because it's not a good scenario. I know that is easy to say, but it's not easy to make. Of course, we can do all the work, but we can do something and we wait for the professional people. We can use the per-hospital attention in all the places. For example, in a restaurant, in some accident, and trauma, or in the street. Bring the right treatments as soon as possible is a help that can make a radical difference in a life. You can take a course in order to be a technique in per-hospital attention. You can help in a lot of things like prevent transfer, an accident, sometimes of catastrophe, of attack in a line situations. You can be a technique or just a helper. The big difference is the amount of information available. And of course, the technique, the most appropriate measure, medication or treatments. The objective is to stabilize the patient before arrival to the medical center, both physically treatments and mentally, like psychological help. All should be include instructions on how to perform CPR in an emergency. The meaning of RCP is cardiopulmonary resuscitation. Cardiopulmonary resuscitation is a technique that saves lives and is usually in many emergencies, such as heart attacks, drowning, inhalation of smoke and toxic gases, and the those currents in which a health bath. For that, it's recommended that all people, absolutely everyone, regardless of trade status, social purpose, garden, job, professional or trade, receive a training of being CPR. I know that many people are afraid to do it because they think they will do it work. But I always said it is important to remember that the difference between doing something and doing nothing could be a person's life. Now, what we have to do? The first thing to do is check if there is pulse and breathing. If the people who have the accident don't have vital sicknesses, we have to getting CPR. Should be started with 30 compressions before 2 recursive breaths. That is a general information, but the most important thing is practice.